Hi, everybody. Welcome to the podcast. I'm Mark Raven from Value Capture, and we're joined today by Rob MacIsaac, the president of Hamilton Health Sciences. Rob, how are you?
I'm very well, Mark. How are you?
Doing okay. Thank you for joining and sharing with us today. If you could start off by introducing yourself and a little bit about your background, would be interesting, to hear how you ended up working in healthcare in a leadership role.
Sure. My name's Rob MacIsaac, as you heard, and I'm the president and CEO of Hamilton Health Sciences. We're one of Canada's largest research hospitals, although maybe by U.S. standards we're probably still large, but not very large. We would have about 13,000 employees. We're serving a catchment area of about 2.5 million people with a series of tertiary and quaternary care services. Generally, we would be ranked about number in the top three in terms of research hospitals in Canada. If you just measure that by dollars income in research. I've been in this job for about 6.5 years. Came to it by a pretty unconventional route. I started my career off as a lawyer, and I was working on Bay Street in Toronto, which is kind of Canada's Wall Street, and wasn't having that much fun there. So decided to start my own practice in my hometown of Burlington, Ontario. And so I did that. And not long after I did that, I was approached to get into local politics. So I ran for city council and became a member of city council. 6 years after that, I became the mayor of Burlington. And I served for 3 terms before deciding to leave. I then took a job as the founding executive chair of the Regional Transportation Authority for Greater Toronto and Hamilton, something that was ultimately called Metrolinx and is still going today. It's a very large going concern today, responsible for running the regional transit, which is mostly a commuter rail system, but also a very significant fleet of buses and so on. I stayed there for 3 years, got it up and running and started, and we developed a regional transportation plan for the region. Subsequent to that, I took a job as the president of one of Ontario's large colleges called Mohawk College, and stayed at Mohawk for 5 years. It was a very fun job. And then I took this job as CEO of Hamilton Health Sciences. Mm-hmm. So a lot of different sectors there. Probably the common themes, though, across all those jobs are public service and leadership. And so that's those are the things that I really like, and I've been very fortunate in my career.
Well, and so along the lines of public service and leadership and doing a lot of different things, many of our guests have shared reflections about meeting the late Paul O'Neill, who, among other things, was the founder of Value Capture, but he spent many years working in the United States federal government and was CEO of Alcoa, and also ended up having influence in healthcare. And I know you're going to share some reflections and how did you meet Mr. O'Neill? Kind of just as a way of leading into the way he influenced some of your thinking as a leader.
Yeah. So not long after I started Hamilton Health Sciences, my chief medical executive came to me and said, I think we're ready to really move on to the next generation of quality improvement at Hamilton Health Sciences. We'd certainly been thinking and doing lots in the area of quality, but I think we felt broadly that we were ready to get to the next step. So he suggested that we take the executive team down to Pittsburgh and meet with value capture, which we ultimately did. And I can honestly say it was a transformative experience for our executive group, and that's where we met Paul O'Neill. And I think it's fair to say, he struck me, and I think he struck our whole team as being an extraordinary individual. My view, after really probably after our first meeting, that was that Paul was a great American. He was somebody who really embodied uh, many of the things that I think the U.S. as a nation aspires to in terms of leadership and excellence, and leading by example and so on. So I was very honored to meet him, and he was very impactful on us. I think at the end of the trip, that first trip, we all felt very energized about the direction in which we wanted to take our quality improvement efforts. And for me, I kind of distilled Mr. O'Neill's message into three relatively simple rules, which is good for me because I can remember those things. But the first is that no organization can be successful unless everybody is feels valued and respected. The second is that everybody in the organization really has to feel that they understand they're a member of the team and what the team is trying to accomplish. So everybody needs to understand the vision and mission of the organization and how their role is really contributing towards it. And the last is that everybody needs to have the right tools, the tools required to do their job. I know those things sound fairly simple, but if you unpack them, there's a lot of meaning to them. And I think that, again, although they sound simple, it is challenging to make them all true in a robust way. But if you do, I think Mr. O'Neill was right that those are profoundly necessary enablers to success as an organization.
Maybe we can unpack those a little bit. So, maybe elaborate on the idea of, what does it really mean on a daily basis for employees to be respected, to feel respected, and to feel valued? And what can you do as a leader to help create that environment in a large, complex organization?
Yeah, I think at the heart of it is recognizing that value is created at the coal face in any organization. That those frontline workers are the people who, in many respects, are the only people who can really help you get significantly down the quality road. I remember a friend of mine who was a turnaround guy, private sector individual who took over a company, manufacturing concern, that was essentially on the verge of bankruptcy, and said, I spent the first 3 months working on the line of this company. And I said, hey, what's going on? Like, why can't we actually make a product that functions? And the workers said to him, well, it was a welder. And he said, I want you to put this mask on and take a look at the weld that I'm doing. He said, I did it and I couldn't see a thing. And I realized that the lights in the factory had been allowed to get so dirty that nobody in the factory could really do a good job or the job they were being called upon to do. That's something that's very difficult to discern from the CEO's office. And unless you're the person doing the job, it's a simple example, but it's a great example of how the quality of the product at the end of the day is so much a function of the person actually doing the work and the insights that they can glean from it. And so I think, there's dignity in every job in an organization. And that's because everybody is playing an important role at the end of the day to getting to the company's vision and mission. And so, unless you give those people some say in the organization, an ability to actually have some input into how you're running the organization, you cannot get to the upper echelons of quality that we're all trying to get to.
One thing Mr. O'Neill talked about a lot when you talk about getting to upper echelons of quality, he would talk about, as we've explored in some other episodes, the ideas of habitual excellence, which, and then really working toward the idea of what he called theoretical limits, which, especially in the realm of quality and safety, could translate to mean zero harm, zero bad experiences for a patient. I'm curious if you can share some of your reflections on, some of those themes that he talked about quite a bit.
Yeah, I think, when I first went to working at the college that I had mentioned to you, we had they had student satisfaction scores that were amongst the lowest in the province. And I think that those scores had been there for so long that people felt that that was just the way things were. And people would often say to me, it's a large college, and none of the large colleges really do very well when it comes to student satisfaction. And there's just no way that you can get a lot better. And I set out a goal for the organization that we should be the best organization, the best college in Ontario for student satisfaction. And I think nobody really believed that was possible. But we kept driving towards it. And when people started to see us making significant improvements in terms of how our students regarded us, it really empowered the whole of the organization to keep, to accelerate, to put their foot down even more on the accelerator. I think after the 5 years that I was there, we were in the top three for student satisfaction in the Greater Toronto area, which comprises most of the colleges in the province. People were right. It was very difficult for a large college to compete with a small college in terms of student satisfaction, but we made very significant gains. And it really started with the notion that we needed to have a big vision, an aggressive, audacious vision for where we wanted to get to. And you had to be persistent about wanting to achieve it. And when people started to see progress and started to see real results, it had an impact across everything that we did. And I think it changed everything. So I think for Mr. O'Neill, he certainly focused in on employee safety and the notion that you could not stop until you got to zero. That zero was possible. And well, I think that particular goal served a number of important purposes, including, again, acknowledging the importance and the dignity of everybody who worked at Alcoa. It also had a kind of effect broadly across the rest of the organization that why would you try to do anything less than be the best you could possibly be at it? So that idea that everything you do, you should do with excellence, I think is a really important part of quality improvement. It's a really important part of leadership.
Yeah, and as Mr. O'Neill shared in his speeches, and I think even if listeners go back to episode 1 where we shared one of those speeches, Mr. O'Neill would tell healthcare audiences about how when he had when he was new to the CEO role at Alcoa, and he would talk about theoretical limits and zero harm. He got pushback. People saying, well, that's not possible. And this is just the way things are. There's that sense of resignation, if you will, or just acceptance. And I think it's interesting when an outsider can sort of try to spark the idea of, well, wait a minute, why do we have to take that for granted? And Mr. O'Neill would talk about the role of the CEO of leaders as helping remove excuses from the organization, which might sound a bit harsh, but I think it's constructive. I mean, I'm curious, hear some of your reflections, and again, thinking of your role in different organizations. How do we help people see what's possible? How do we, whether you call it eliminating barriers or removing excuses, how can we go about that?
Yeah, well, for sure. I mean, at the start, it does. I think it starts with the CEO's insistence on a dedication to excellence. But I think the other thing about my second rule that everybody understands, uh, the role that they have in terms of helping the organization accomplish its mission and vision. It implies a number of things about the job of the CEO. The first of which I think is to get to a really compelling vision for the organization.
Mhm.
That's not something that it's a role that's really peculiar to the CEO's job, and it's something that I think can distinguish a good CEO from an average CEO. But then, having achieved that vision, which has to be much more than just about making a profit or balancing your books. It has to be something that people feel motivated by, and then communicating it out in a way that people can understand it um, and are motivated by it. I think they're both really important parts of that second rule. Um, and I know in every job that I've had, I've gone in and there are certain people who I've understood from the first day because of the way they were able to communicate to me about the nature of the business. There were other people who um, I might not have ever fully understood during the whole of my time during any particular stint with an organization. I guess what I'm driving at is this notion of clarity and simplicity in the way that a CEO communicates is really important, and it's easy as anything to get kind of caught up in the jargon of the business. But I think especially for people coming in from the outside, you're not caught up in that jargon, and nor should you ever allow yourself to be. And you have to be able to on an ongoing basis, communicate to everybody in the organization in a way that they understand and in a way they find compelling. And it should be grounded in that notion of excellence.
So maybe, final question. When we talk about, coming into an industry again, do you have any other lessons or reflections or aha moments, coming into healthcare and seeing, what translated from a leadership perspective and what's different or unique about the challenge in creating habitual excellence in healthcare?
Yeah, I think I mean, others may disagree with me. I guess one of my big realizations about healthcare, and it's certainly been confirmed over the last 3 months, is that it is a sector that is sort of very much driven by crisis, very much focused on the here and now. And I totally understand why those are really important skill sets for healthcare. Um, and, we've been dealing with this COVID crisis for the last 3.5, almost 4 months now. And it's been extraordinary to watch my team and how well they've been able to respond to demands that were next to impossible. But I think that, the other side of that coin is that healthcare is not naturally strategic. It it's a sector that you really have to poke and prod to get to strategy and to um, get focused and to remain focused on strategy. So I think, for me coming in as an outsider, that message from me to my organization has been really relentless about understanding, where we're trying to be 3 years from now, 5 years from now, what the key enablers are to achieve that, and then relentlessly driving those things on a day-to-day basis, making sure that almost every communication I make with the organization is related to our strategy and why we're doing it.
Well, really appreciate you sharing, some of your thoughts and reflections here across not just healthcare, but other settings, Rob. Our guest today, again, has been Rob MacIsaac. He's the president of Hamilton Health Sciences. Is there any final thought or tip that you might want to leave the listeners and viewers with?
Yeah, I think if I just again reflect back on that first session that I had at Value Capture, meeting Mr. O'Neill, I think what I found most liberating, and I don't know the extent to which, I suspect this is a common experience across most healthcare systems. It's such a relentlessly grinding sector from the point of view of, always constantly being asked to do more with less. And it can definitely challenge your resilience. But I think what I found most liberating from meeting with Mr. O'Neill and the Value Capture team was the idea that the way forward for healthcare was not continually asking people to work harder, to do more work. That it was really fundamentally grounded in this notion that if we can drive waste out of healthcare, there's more than enough resource to do what needs to be done. But it's really about finding the waste and driving it out. And, if there's, I think for most of us, if you ever have any doubt about how much waste there is in the system, you just need to follow a nurse around for a shift and see how many things we ask those nurses to do, which really have very little to do with adding value to our patients at the bedside. So there is lots more to get to, and it's kind of a liberating thought from my perspective.
Well said, and thank you for that key point and that reminder for everybody. So Rob, again, thank you so much for taking time and being our guest here today. Really appreciate it.
My pleasure, Mark. Thank you.
Best wishes to everybody, to yourself and everybody there in Hamilton, the important work you do. Thank you.
Same.